Good morning, good afternoon, good evening, everyone. So we are about to start the webinar on the pandemic agreement to support meaningful prevention via One Health. Maybe we will wait just a few minutes for everybody to join. So meanwhile, I will just give you a short introduction. So this webinar, so welcome to this webinar, which is a special edition, which is co-hosted by PREZODE, 4PAWS, and John Hopkins Center for Health Security. And we are going to talk today about can the pandemic agreement support meaningful prevention via One Health? So this webinar is also organized in collaboration with Born Free Foundation, Health Diplomacy Alliance, Phoenix Zone Initiative, Proyecto Arapa, World Animal Protection, and World Federation for Animals. Just to let you know, there is 2 interpreters which will translate this session in French and in English. Please note that the webinar is also recorded and the replay will be available shortly. The translation can be found at the bottom of your screen. Before I give the floor to our moderator and speakers, I would like you to send your question to the Q&A box. And please, when you do so, do not use the chat box for questions, but use the specific Q&A box that you can also find at the bottom of your screen. And we will answer all these questions during the roundtable. And now it is my great pleasure to welcome Dame Barbara Stocking, Chair of the Panel for a Global Public Health Convention, who will moderate the discussion today. Barbara, the floor is yours.
Thank you very much, Marissa. It's a great pleasure to be here today. Of course, none of us wants a pandemic. The issue is, how do we stop that? And of course, we can reduce the number of pandemics by good surveillance, good early action.
Une surveillance, une alerte précoce, mais on veut aller au-delà sur comment prévenir les débordements entre les animaux, les oiseaux et les êtres humains.
Y la relación entre los animales, los seres humanos.
Low-income countries, about how far they can go in both those areas, the joint One Health surveillance and so on, but also really getting to the bottom of the issue. So we'll be talking about all those things this afternoon, and it's a particularly important time because on Monday, the agreement, the international agreement is going to start its last week, and we hope that by Friday we might have a pandemic agreement. So it's sort of your last chance here as well to put some thoughts in about what we need in the pandemic agreement and have we gone far enough or too far. So that's what this is all about. And now I'm going to just introduce briefly our 4 really excellent speakers. The first will be Dr. Sawapak Hinjoy, from who's PREZODE's Vice President, but also a One Health expert in the Ministry of Public Health in Thailand. Then we have Nina Jamal, who's the International Head of Pandemics and Campaign Strategies at 4PAWS International. And I have to say, from being there a lot, she sat through most of the negotiations in Geneva. Dr. Alexandra Phelan, who is Associate Professor at Johns Hopkins Center for Health Security. And last but not least, the man on the ground, Dr. Chris Walzer, and who's going to talk more from that end of the work. So I'm going to go straight in because we haven't got a lot of time and say to Dr. Sawapak, can we go now ahead with your presentations, please?
Okay, thank you very much for introducing us, and adding the you can see from in the slide presentation, maybe in the okay, great. And I would like to say that in the good morning, good afternoon, and good evening for everyone that in there to join from around the world. I'm Sawapak Hinjoy, the Vice President of PREZODE. It's my honor to share with you today our global finding on the One Health governance and its implementations, especially focusing on the countries in the Global South. This study, as you can see from the title, is conducted with over 240 partners in 70 countries, gives us the valuable insights into how countries institutionalize and operationalize One Health, what works, what doesn't, and where support is more needed from that is the feedback and the voice from our the country around the world. Next slide, please. PREZODE. This is as you can see from our logo. This is preventing zoonotic disease emergence. This is its abbreviation, the PREZODE. PREZODE is a global initiative. We focus on preventing pandemics before they happened, especially those that come from animals. Okay, and we are so capable protecting food, health, and local communities. That's kind of all the components that related and help interconnected among each other. But the prevention, this is our keywords. And this study helped us to understand how the countries organize their One Health work in their countries, and what any support that the country reflects and voice to us. Next, please. This is we have using a mixed scientific approach, and also have a global literature review is one our methodology, and we also interview within the 20 One Health expert, and also we have delivered the survey and ask for all the participants to answer, and we got a very good feedback from the 225 participants from 80 countries. And also we have the process to analyze what in the pandemic agreement that during the negotiation process. So this kind of a data source help us to understand in both of the national system and also at the international forum as well. Next, please. Okay, this map shows how far countries have gone in the term of the institutionalizing One Health. Okay, and you can see from the map that some countries have no formal process, but other already endorsed and in the policy maker, they have a policy framework or the formal platforms. So that means we have a different kinds of how they operational how they operation in the term of the One Health. And you can see that many global South countries have made a lot of progress and proving that the formal One Health governance is not only the accuracy to the high income countries. This is important that most of the country, both of in the lower or in the middle income country, they have a process in the term of the One Health governance, maybe in the operational activity, join together, maybe in some country already have a formal platform, or some country is still the informal platform to join in the term of One Health framework. And next, please. Okay, next slide, please. Okay, great. This is give you to provide more detail. When we said that some country have a One Health operationalization, or some One Health is just some country have already have an institution of the One Health to conduct or the implement of the One Health. So this kind of the more detail. You can see that in the that's it's kind of we are so divide into in the region, and we are so a divide what in when we say that operation, maybe in some country have a fully operationalized, some countries just partially, and some countries have not yet established any a One Health operation. But you can see that in the most of the country are still in the partial implementation state of the One Health governance, but it's not depends on the which region. You can see that in the some region have both kind of a partial and the fully operational on the One Health. So it doesn't mean that in the just only for the high income country have a full operational for the One Health, but some a middle income and lower middle income, they also have a One Health operationalized, and also maybe it's just a partially, or in the some country already advanced in the fully as well. So this is from our result, it is not clear the pattern between like the high, lower, or in the developing countries have like related or in the like have associated within the full operational on the One Health governance. So that means is not like no pattern about this. And the one thing is clear from these graph. You can see that the country with the strong governance does away have the strong action on the ground. This is a clear is one thing that we can see from the graph. And those with the weak governance, they may have, but some country have like a weak governance on the One Health. They always have like a struggle with the implementation. Okay, next slide, please. And we try to group what in the term of in the components between like governance, operation, right, and in the region and the country. We try to group in the cluster. And you can see that in the some country in the from different region, they have like a good system on the One Health, but not fully active yet. But some country have like a not so formal in the term of the One Health governance, but they're very active on the ground. And some country is both kind of the weak system and also in the weak actions. So that's mean from in the this our result, it show that in the what matter most isn't like a reflect on the region or the income. When you say that this is a strong operational or in the strong governance, it's not reflect on in the region or the income. But even we can see that even in any country, they say that they have worked well together between health, everyone, environment, and agriculture. Yes, they also like reflect that they have like a very improvement in the term of how to contain the disease, how to control the disease, and how to manage any outbreak or any health threat that occur in the country. Okay, this is from our result. Okay, and next slide, please. Okay, what's in the result when we analyze in the term of the One Health governance, in the structure and also operation and any gap that occur in the country. And this kind of like the key messages that in the it can be revealed from our study. For the first one, in the each region, they have the mixed kinds of the pattern of the One Health governance, but we can see that in the East region, they always have like a champion. That means we call One Health champion. Maybe it's good even we can promote and we for the country that can be like a One Health champion to share the knowledge, to share like the best practices for the other country in the same region. Okay, and the another One Health need to be rooted in the national priority. It's just not like by put in the forces by the international or the global agenda, but even we would like if we would like to see the strong governance and strong operation, the country need to prioritize the One Health in the national priorities. And another message, equity is essential. The country with like a fewer resources need to be supported. It just should not be left behind. According to the equity, that means maybe some country have like a very strong in their some resources, and so with that they can share or they can work together. This kind of like how we can support in our communities. And the funding is a foundation. That means there may be some country didn't have kind of like their initial investment. It's hard to see like an operation, the One Health operation will be occur. So that means this away happen in the country is a low income setting. So that means like the initial investment is like the keywords that in the how to like strengthen the One Health governance in those countries. And so finally, we have to use like a scientific evidence. This is from this result, it's just like one of the evidence that in the can shape our policy, and we can know what the gap, and we can know what in the strong program and how we can fill on those kind of the gaps. This is what we need to use in the term of the scientific evidence. Okay, and the next slide, please. Okay, this is would like to thank all the expert researchers and the survey respondents that in the from around the world that in the make this possible. This study is covered like one of the sample that in the we do cover like a teamwork across in the many countries and organizations. And last slide, please. The next slide, please. Okay, and the resource, I would like to highlight again that in the we believe prevention is better than cure. And we invite you to join our movement for the safer, healthier world. And thank you very much for attending. Thank you.
Good. I think hope I'm just coming back. Thank you very much, Soapak. That was an absolutely brilliant presentation, actually, very clear and so much work. It's also, I think, very encouraging. I've learned something already today, that it doesn't have to be low versus high, that there are mixes in each of the regions, which is really helpful to understand. So much appreciated that talk. Now, the next person we're going to hear from is Nina, who is going to come to the issue of the moment, the pandemic agreement, and how this all fits in there and what we ought to be saying in it.
Thank you so much, Barbara. Can you see? No, you can't see the slide yet. You should see it now. Do you see my slide?
Yes.
Perfect. Hello, everyone. Thank you, Soapak, for this very exciting presentation. And it shows us that there is action underway, a lot of action, and in a lot of developing countries as well. So the first thing I wanted to capture, building on what you presented, is that we are currently witnessing an exciting and necessary evolution in the way the global health policy is designed and implemented. So we're seeing a shift away from symptom control, response strategies towards tackling the root causes. We're seeing more focus on collaboration through One Health approach. We're seeing a shift away from an anthropocentric view to health, where the problem does not start after animals and humans, animals and the environment get sick, also humans, but also we look at what we are doing as humans to make them sick and how that affects us. And we're seeing a shift also viewing health as an investment and health for all as an outcome rather than as an expense. Now, based on what you presented, we've distilled certain essentials that we'd also like to see in the pandemic agreement to mainstream and support all the efforts that are existing among, so within member states. The essentials in a nutshell are that we need to see governments developing multi-sectoral prevention via One Health strategies that prioritize high-risk practices with measures that tackle the root causes of diseases and prevent outbreaks at source, and that these efforts have to be supported. They have to be supported by clear guidelines, a knowledge or science to policy process. We say knowledge because it's not just traditional scientists, it's also knowledge in communities that we need to learn from. We need to see an exchange of best practices. We need to see support from implementing agencies when governments need it. And we need to see technical and financial support. And I'm going to share a little bit about what's in the legal text, but I will not talk about the legal language because this is what Alexandra is going to talk about. So not to take away an exciting set of insights, but I'll look at the essentials in more detail. So the essentials are developing comprehensive multi-sectoral national prevention via One Health strategies that have a clear scope on what prevention entails, prioritize the high-risk activities and settings, prevent disease transmission between animals and humans, so spillover and spillback, address the drivers of outbreaks and factors that increase risk of pandemics, and take measures aimed at prevention at source, including safe and responsible management of farm, wild, and companion animals. And now, if we look at the treaty, these essentials are in the legal text, but there are color codes. So for those who have not seen the legal text yet, green would be there's initial agreement. And you'll see here on these essentials, no agreement has been reached, initial agreement has been reached. Yellow means initial convergence. So on some elements, you see initial convergence, and on other elements, this is still bureau language. And if I zoom in on the most important elements tied to effective prevention, settings and activities. When governments identify settings and activities, that helps them develop priorities. That helps develop what the strategies should focus on. Spillback is still marked blue as well in the legal text, so Bureau proposal. And this is important because we need spillback because we should not only look at how pathogens jump from animals to humans, we should also include in the scope pathogens jumping from humans to animals. Prevention at source is also blue and important. We need to see it greened because it's about the earliest stages. It's about tackling the root causes. This is how we achieve equity. And the wording, safe and responsible management or handling of farm, wild, and companion animals was in the legal text, but is no longer there. What we now have instead is taking measures to identify and reduce pandemic risks associated with human interactions involving wildlife, farm, and companion animals. Having wording like safe and responsible handling would make it more concrete. It would help governments say, we're not doing everything related to how we're dealing with animals. It's not about all interactions. It's about safe and responsible handling when we are in contact and when there's a danger. So having that kind of specific language is actually helpful for member states. And then, exactly, so perfect. So I'll share a few more essentials, 2 more slides of essentials. When we have these strategies, they would be effective when they are in line with the One Health approach. The One Health approach meaning in line with the One Health high-level expert panel definition, that they're in line with commonly agreed guidelines, enabled through formal coordination across sectors, which we have seen is established in many countries and would be mainstreamed through this agreement and supported. Strategies should be designed with the communities at the front lines of an outbreak and must be informed through risk assessments and multi-sectoral surveillance. And here we see a bit more green, but the spoiler is the green elements are not in Articles 4 and 5 about prevention and One Health. They are in supportive articles. So for example, in the use of terms and the definitions, we have the One Health approach using the language by OLEP, mostly green, with just one bit that still needs finalization. We have language on commonly agreed guidelines, but it's still marked blue and yellow. And here I wanted to highlight guidelines because they're important so that all governments are clear on what they're all working on, but also these guidelines inform implementing agencies and financing bodies when they see governments aligning on specific types of actions and activities that they want to implement. This adapts what the financial institutions and the implementing agencies prioritize. They see this is important for member states, so they will also prioritize it. Then community engagement, I mentioned, is important. This is where equity can be best achieved because communities are at the front lines of an outbreak. If we help them prevent the outbreak, then this prevention is most effective because it's before they suffer, before humans and animals suffer. And if they're part of the strategy, then they own the strategy. They help design the solutions. They're part of they're helping, they're contributing, but they're also protecting themselves. Risk assessments and surveillance is still also not finalized. And I wanted to mention it because these measures do not only inform early warning, they help governments understand what's driving outbreaks in their countries. And that will allow them to develop more effective strategies because then they would incorporate those drivers. They know what to do differently in different areas. The last bit of essentials, and here I'll just jump to the one with the colors, is also a couple more things about effective strategies. And here this is also, so OPAC mentioned, support for implementation. We need technical, financial support, implementing agency support, sharing of best practices. And here, the supportive articles, so here we have Article 19 on international cooperation and support for implementation, Article 20 on sustainable financing, Article 9 on research and development. They include these kinds of enabling measures that we need. In Articles 4 and 5 on prevention and One Health, that language still needs to be finalized and it has to be captured because governments must be offered support for these important obligations to achieve equity and prevent pandemics at the earliest stage. And then one final point I wanted to look at is about coherence with international, within the international legal architecture with other legal instruments. This pandemic agreement does not exist in isolation. We have the Climate Convention, we have biodiversity, CITES on endangered species, so many different international instruments, and they cover bits and pieces of prevention, but they don't focus on prevention to protect human health. So we need to better understand what these instruments are requiring, what does the science say, and where are the gaps? And here we have language also in Article 19.3 about strengthening and enhancing cooperation among relevant legal instruments. And here it could be further strengthened. So to sum up and hand over, I'm very curious about what Alexandra will present. What we have in the legal text is a foundation that must be finalized and built on. We have the essentials content-wise, but they're mostly still Bureau language, and they're based on former iterations by member states. So the Bureau did not reinvent the wheel. This is language from previous sessions. This language must be strengthened, clarified, but not weakened. We need it, not just, we need it for all countries. This is about equity, and we don't just need obligations for prevention in One Health, we need obligations for support for implementation. This language also needs to be finalized. All member states must prioritize consensus finding. They're not all on the same page. They're still debating, but even the countries that are blocking or sharing concerns about One Health are One Health champions. So this is more about finding a common ground and advancing the process. We need them to work on the Bureau proposal. The language is far from perfect when we talk about content and essentials, but we view the current articles as a foundation we can build on. And we need to capture this foundation in the pandemic agreement and fill the gaps in the next steps. And I'm very curious to hear from Alexandra. Back to you, Barbara.
Thank you. Thank you. No, that was really excellent. And I hope that that gives people a lot more information on the background of what's going on and what's important, what's happening and what's not. But I think you've just been introduced anyway, Alexandra. Would you like to explain about some of the legal matters?
Wonderful. Thank you so much, Barbara. And thank you to my previous panelists. Let me share my screen. So Nina, I hope that I can satisfy some of the curiosity or at least emphasize and reiterate some of the points that you made, because I think we are in agreement on a number of points. So I want to talk about why the pandemic agreement from a legal perspective, why that matters for prevention and One Health and advancing prevention and One Health for pandemics. Now, it wouldn't be a legal presentation if I didn't start with a short disclaimer. What I'll be talking about today is not legal advice. This is my scholarly opinion and perspectives that I'm sharing. And I think that as we go forward, and if we do have a successful pandemic agreement, there will be lots of scope for engaging with your council and your relevant jurisdictions as we go forward for interpreting these obligations. But what we do have are the negotiations and the discussions, broader scholarly, like scholarship and literature to help guide where the text is at this point in time and what member states have been thinking, what the Bureau has been thinking in its text. And so I think drawing from that broader international law scholarship and theory, this really helps inform why a treaty matters. Nina very eloquently said that this is a treaty that doesn't exist in isolation. It exists within this broader sphere of international law. And that existing legal landscape is going to be critical to thinking about how the treaty is implemented and how it's interpreted. And I think one of the key things that this treaty does is that it addresses the significant gaps both in content and in process that exists in trying to achieve prevention for pandemics, when we think of prevention broadly, and a One Health approach. So the existing legal landscape is largely filled with a lot of soft law, so non-binding international instruments. These are really critical and important. That's not to say that these aren't important instruments, but that does mean that there's a degree of vagueness and a degree of specificity that we don't have around obligations and what countries should be doing, or at least an agreement between countries about what they want to be doing together and independently to advance pandemic prevention and One Health. There are legally binding instruments that are relevant, obviously, the international health regulations being one of the key ones that we'll be talking about today. and that have been pivotal in advancing pandemic prevention, preparedness, and response, somewhat indirectly. And we'll talk about some of the amendments and how they interplay with the Article 4 and 5 of the legal text. But I think the core message that I want to convey is a pandemic treaty, an agreement, a legally binding agreement that includes prevention and One Health obligations, carries a significant normative weight. And what do I mean by that? It is highly persuasive to countries. Countries recognise treaties as being special, as having something different, as having a particular consideration that they may not place in the same way with other types of international legal instruments. There is, we can see that around the tensions of where a comma is placed or what word is used. There is a particular special weight that countries put here. And I think we can't discount how much of an achievement it will be to have a legal instrument that is binding at the international level that includes prevention and One Health. It also helps create a governance framework, that is the bodies, the systems, the processes that start us on a journey about detailing what prevention and One Health obligations will look like. This is only the beginning of the process from my perspective. This is the first step, and the structures that the treaty puts in place are almost as important, perhaps even more important than the exact provisions as they stand. So I think we need to see the inclusion of that text is so critical, of that prevention and One Health text is so critical, and also as part of the start of a process. A treaty also will help provide us with clarity and direction, and I want to deep dive briefly into a couple of those areas where greater clarity will be incredibly helpful for advancing prevention and One Health. The first is defining One Health. This is an issue that has been pervasive for One Health for many conceptual models, including, say, planetary health, which is an area that I work in, and providing that definition, a sort of sole point where we can refer to and at least build and develop. It's not necessarily a static definition. We already have a proposed inclusion definition in the pandemic agreement. It does have some blue text. So we've got green text here, the green text, and some blue text relating to contributing to sustainable development. And of course, this is subject to change, but I think this gives us a snapshot of the power of having this articulated definition in one place that then can be used to interpret the whole agreement going forward, but also as a reference from international or more broadly. And knowing what this is, I think, will be so critical and is such an advancement. Prevention, by contrast, is not currently a specific definition in the text, and that may occur. There is open space for it to be included in Article 1, but we do have it impliedly defined through Article 4's contents itself. And Nina went through a couple of these. They are largely still yellow, but they do cover a range of critical areas when we're thinking about prevention, including those environmental, climatic, social, anthropogenic, and economic factors, these upstream drivers, as well as some of the more specific things like wash and immunization that people may be more experienced with in the preventing outbreak from becoming an epidemic, becoming a pandemic. There are some still blue areas, and I think that spillback that was referred to, and then specificity of pathogens in animal populations, I think would be really critical inclusions for ensuring that how we define prevention is sufficiently broad to take the action that we want to take going forward and into the future about preventing pandemics, and integrating a truly One Health approach. Now, the IHR amendments, which will go into effect later this year for most countries, does expressly expand to include prevention in a number of provisions. The challenge is it's not defined. We have its inclusion in a range of core capacities, referenced in Article 5, the new Article 13 around Article 13 around public health response, including equitable access to health products, and Annex 1. We don't have it expressly mentioned in international cooperation, assistance and financing, which is a critical mechanism for collaboration and coordination across sectors and for financing mechanisms. So whilst prevention will also help the definition of prevention in the pandemic agreement will help provide some degree of specificity and perhaps something that the IHR would reference and refer to, and not necessarily be directly bound by in any way. These are complementary agreements that are interpreted consistently, but not necessarily direct on each other. This would provide a bit more guidance and direction within the realm of pandemics. And also it would help address this cooperation, financing and assistance gap that we have in the IHR amendments. Now, there are some sort of subsets where some prevention can be captured by certain parts of Article 44, but I think having that comprehensive inclusion is going to be, for a financing mechanism and governance mechanism, is going to be critical. As I mentioned, the limitations of the application of and the lack of a definition in the IHR, the scope as it applies currently, and then the entry into force are relevant, along with the fact that the IHR is specifically focused on potential public health emergencies of international concern, which is a slightly different focus and pandemic emergencies than pandemics specifically. I just want to finish by flagging a couple of key issues that are really central to why addressing Prevention One Health strongly in the treaty is so critical. This express linkage between environmental change and health is something that is desperately needed. We have environmental health and human health, animal health are quite clearly segregated in their silos, despite attempts to try and defragment the way international law operates. The Paris Agreement did really advance this recognition of environmental change and health, but this is an opportunity to provide greater specificity around how countries can act to address the upstream drivers of pandemics in terms of environmental change. We also could go further when it comes to multi-directional informational sharing. The international health regulations, Articles 6 and 44, do have these collaboration and cooperation between international organisations, allowing WHO to share information with WOA, with FAO, with other institutions, but that's sort of unidirectional. And really, we need that information sharing across institutions throughout the quadripartite for truly a One Health information sharing system. So that's one area where that I think we really could advance more. Antimicrobial resistance is critical to start to build that legally binding framework and obligations that exist to start to address AMR. We do have political declarations and a global action plan. Really, there hasn't been significant advancement on express obligations to start addressing this really urgent issue. Equity is core to all of this. This is an opportunity as we shape an instrument that is guided by the principles of inequity and solidarity to instill equity and solidarity in prevention, in One Health, in these obligations more broadly, and through that lens really helps frame the perspective of financing, of governance, of how obligations are crafted and shaped. And I think that is a really a critical issue that if we come back to the core driver of this instrument being equity, how that can shape these obligations. The annex has been raised. I think that there are concerns about pushing this to the annex. I think that is correct, but I disagree with the reason. So there's been a number of commentators have spoken about their worries that an annex would cause fragmentation. An annex to the treaty, I do not believe causes fragmentation. I don't see that as an issue. I see this as part of an iterative process. As I mentioned, this is all part of a process. I think it's more important that the text itself has sufficient language. That is more important to me than an annex. And as long as we have that sufficient language that allows us to then move forward, whether that be an annex or further decisions by the governing body, then that's the path forward, and that the text has to be sufficient.
Alexandra, can we draw this up? Good, great.
Absolutely. This is my last line. Thanks, Barbara. I think we shouldn't understate how important progress and normative change is. This treaty itself is going to be, if it is adopted and we have strong One Health and prevention language, we really need to celebrate what that progress means and use that as momentum to go forward and continue to create the governance system for preventing pandemics. Thank you very much.
Good. Thank you very much, Alexandra. And that was, again, a very good understanding of what's going on in the legal matters. But Chris, it's your turn now to get back to feet on the ground and how you see things and what are the issues there.
Yeah, thanks very much, Barbara, and thanks very much for having me in this panel, and thanks to my colleagues who've spoken before me and set the scene. So from a field, I'm coming from the Wildlife Conservation Society. We're an organization that works on the front lines of where spillovers do happen. And so I want to bring you some field perspective. Central from our point of view to this agreement, to this draft agreement, is obviously Article 4, which calls for countries to develop plans for coordinated multi-sectoral surveillance across human, animal, and environmental health. And, you know, it's kind of surprising, 2025, and I have to actually point this out, this is critical, right? This is a central thing. We've had discussions about some negotiators thinking this is not important, but I want to point out that the majority of emerging infectious diseases originate in animals and particularly in wildlife. So if you do not have a multi-sectorial collaborative surveillance system in place, you're not going to be able to recognize when pathogens emerge and diseases can develop. So we absolutely need the multi-sectorial, or as in WHO speak, maybe collaborative surveillance approach. And this takes a One Health approach. As Alexandra and others have already pointed out, that's in Article 5 and recognizes the interdependence of human, animal, and environmental health. I think the idea that we need another definition of something is mute as far as I'm concerned. We have a great OLEP definition. We don't need to go back. I think this is being used constantly by actors who have other agendas and who want to confuse everyone. There's absolutely no reason. There's no confusion here at all. So I find that quite interesting. Now, what does all this cost? This is something that countries have raised concerns that planning and implementing multi-sectorial surveillance may be difficult because of resource limitations, coordination challenges, and data sovereignty issues. However, these issues have been addressed in multiple countries, as we heard in the introduction piece. There are plenty of countries that are already doing this. Most of those are in the Global South. Let's be very honest about this. The leaders are in the Global South, are in Africa. They have these programs in place. Sure, there's resource constraints. It's difficult, the implementation, but at least many of the countries have thought this through. I just point 2 or 3 out. Rwanda, Zambia, Nigeria have fantastic One Health national strategies and are implementing that. Remember, these are the countries that have the most experience with multiple infectious diseases emerging, be they endemic or emerging, like we've just seen with Marburg virus and so on. I just want to show an example, one of our things. The Republic of Congo provides a really good example of how multi-sectoral surveillance can be built up. So following a devastating Ebola virus outbreak that took thousands of lives and threatened the grade A populations in the country, there was a collaborative effort between wildlife experts, conservation experts, and the Congolese Ministry of Health to establish a low-cost wildlife mortality reporting network, which covers 50,000 square kilometers. And this serves as an early warning mechanism for potential future Ebola virus outbreaks that have been linked to wildlife in the past, of course. But it's a super resource efficient surveillance system. And over the years, as this has developed with hundreds of communities, there's more than 6,500 people involved in this network, which works on 3G, basically messaging system. They've reduced the time of diagnosis from the front line from weeks, when we started this more than 20 years ago, to hours. Nowadays, within hours of finding a carcass, diagnosis can be made in the field. And it's based on a cell phone network and SMS messaging in 3G. So these things can be done. It's about coordination and the willingness to do it. Let me also talk about co-benefits. You're not only detecting diseases which impact humans, you also have the advantage that this front line helps you detect livestock diseases which are consequential. May that be African swine fever, may that be peste epidemic ruminant, FMD, which we're seeing cropping up all over the place at the moment, and so on, and obviously avian influenza. So I'm going to keep this short because I really want to hear the questions that are coming from the participants. But this coordination between health, animal, and environmental sectors is definitely a challenge. It requires these clear communication channels. It requires a lot of building of trust. This agreement provides a great framework to do that. It supports multilateralism, which is under pressure at the moment. But remember, without this kind of agreement, pathogens don't care about if you want to embrace multilateralism. Pathogens move across borders at a speed that you cannot imagine or you have seen during COVID-19. So this agreement will help formalize these mechanisms, will certainly ensure smoother cross-sectoral cooperation, and also provide some framing for data sharing, technology sharing, and other things which interact with these Articles 4 and 5. So I'm just going to leave it there because I really want to give some space to the participants so they can answer questions. And I'm happy to build on this if anyone wants to. So thanks very much for that.
Yeah, and thank you, Chris. Again, another optimistic can-do approach to it. Now, we are a bit short of the time, and I just wonder if we might take the questions that have come up from the audience here to answer, rather than starting from ones that had come in just online earlier, so the people who are here can hear what's being said. I don't know whether that's possible, Elsa.
Yes, absolutely. Thank you, Barbara, and thank you to our four wonderful speakers. That was so insightful. We had indeed quite a few questions from the audience, and please do not hesitate to ask more. I'll just picking some. So there was Elena who was asking, how can we measure oh, this one is a good one. Institutionalization of One Health. So coordination mechanism in place, MOU, One Health action plan in place. And are there any levels of institutionalization, and which one should we prioritize? There was also Andrew who was asking about Article 4. And isn't the lack of surveillance for changes in human-animal interactions a major gap in implementing effective prevention? And there was also Mark who was asking that there has been mention of collaborative surveillance, implying that technology plays a role in this. So is there any technology leaders actively engaged in developing these networks? We'll start with these ones.
Okay, well, that's good. And I'm not quite sure, all of the four panelists can join in if you want, so just do that. But I feel the first one probably does belong to Sauerpack, because it's actually about institutional levels, which you've got, pretty well charted on your work. So do you want to have a go at that?
Okay, thank you, Babala, and okay, thank you for the questions. As in the from our presentation about the institutional rights and operational rights and how we can measure that. And actually, in the right now, we can see it in the from in the tripartite or in the tripartite organization, for example, like WHO or in the FAO or WOHA, they have a lot of like a tool that in there how we can look at on in the measure that in the related to the One Health. And for example, even though we would like to see the institutional rights, One Health governance, that means, for example, like a MOU or in the policy framework or in the national strategy that related to in the One Health. This is kind of like the one of in the measurement that we can see how the country can be institutionalized and how they can like have the framework and join as the policy maker and can bring that to like for the budget allocation. Okay, that is kind of like the one measurements for in the term of the institutions. But for the operation, even the, for example, even the we look at on in the JEE, Joint External Evaluation for the IHR, you can see that in the they have kind of like they ask us like an indicator that in the between the sector how we can have like a joint outbreak or a response, or in the how we can share information and how we can like set like the sending message or in the alarming the message if there any abnormal event occur. So that's kind of in the measure that in the how we can do in the term of in the operation. Okay, that is my response about in the institutional and also within the operation.
Okay, now for you other three, and particularly I think Nina and Chris, do you want to try the other comments that were made about the major gaps and all about collaborative working?
I can jump in. I mean, the point with collaborative working is you gotta start where it is at, right? So it depends. It's very context specific. Different countries, different regions are at different stages of developing collaborative surveillance networks and collaboration generally. So we've had meetings that went on for days where we were happy that the chief veterinary officer and the chief medical officer had met for the first time, which is extraordinary, and had exchanged WhatsApp messaging, right? So they were able to communicate. Now, that doesn't sound like amazing, but this is a first step, because if something happens, they actually can collaborate with each other. Others, of course, are highly engaged in developing technological systems, coordinated open access systems to share data across their various sectors between ministries. There's some strong working groups that coordinate across FAO, WOA, WHO, and so on developing data streams and data systems. So it's really context specific, and you need to start where the countries are at. I think this is really important. You can't just come in with a blanket. You know, the Joint Plan of Action from the Quadripart is a fantastic document. It also needs to, and it acknowledges that it needs to start at different places, depending where the countries are at. I think that's the most important.
And Nina, do you want to come in on any of that?
I think Chris answered perfectly.
Yeah, okay. Do you want to, Elsa, have a go with some more questions?
Yeah, so we also had a very good one from Ludovico Sepe, a question for John Hopkins, actually. So this one is a targeted one. How are the legally binding articles going to be enforced?
Okay. And others, do you want to give me another couple to go?
Yeah, and so I think we just go back also to the surveillance regarding, the lack of surveillance of changes in human-animal interactions, how this is a major gap in implementing effective prevention.
Yeah, where's the gap? That's two. That's the legal enforcement. Go on. And the third one?
Yeah, and sorry, latest one is sorry, I've lost something. Is yeah, say the mention of technology leaders that are actively engaged. If you have any technology leaders that are actively engaged in developing network surveillance.
Okay, so legally binding enforcement. That's Alexandra. That's your bit.
Yeah, so I think this question is often asked of international law. You know, if we don't have a global police or a global, we do have a world court, but if we don't have global police, how are things enforced? I think the starting point for that is to sort of say that the fact that, it just as with our domestic legal systems, the fact that something is a crime is not necessarily the reason why you do or don't do it. The fact that murder is a crime is not the reason I don't murder. So I think the fact that we're putting this language into text, so we're putting these obligations down, that's what we mean by normative weight. So the lack of a police force or like what we'd consider a parallel to what we see in our domestic systems doesn't necessarily mean that it's not incredibly powerful and persuasive and binding, and that countries won't act to meet the standards that they've agreed to and said that they will commit to and that they will set. That being said, there are provisions in the agreement for, firstly, the settlement of disputes, that if disputes arise between countries about how to interpret the agreement, as well as providing processes for the conference of parties to establish a facilitation, or sort of more of a, I think they call it a mechanism to facilitate and strengthen effective implementation of the agreement. Now, that's a non-punitive mechanism. The idea is looking at best practices and, how can you improve compliance through a sort of a positive and a reinforcement angle. And that's very similar to what we've seen in other areas of international law and where the trend has been going. I know there are folks that are wanting a stronger compliance mechanism, or we might see that in that the Conference of Parties is open to consider other possibilities like the IHR State Compliance Mechanism Committee that's going to be established, as long as it's still non-punitive in focus.
Yeah. Okay, that's good. Now, surveillance and technology. Nina, Chris, Sarpak, who wants to say something?
Chris might know more than I would.
Right, go on, Chris.
Yeah, so there are multiple initiatives ongoing at the moment to coordinate data sharing, right? This is from frontline systems like Smart for Health, Earth Ranger for Health, which is, by the way, it's the same thing, that empowers basically rangers, eco-guards, and similars at the front lines of spillover to provide health-relevant data into a central database. The problem with these is that many of these databases and data collection systems are created initially sectoral, and then it requires quite some effort to integrate them at a national and at a regional level. And I have posted some links in the chat, so please have a look there. There's one of the examples. I'm not saying this is the example, it's the one we work on, but there are some of those. So it's important, of course, to coordinate across the quadripartite to make sure that this data is collected. But remember, just collecting data is only it's less than half the thing. The analysis and then using that data to inform and policies and decisions is really another step as well, right? So we have to talk, and this would really blow up this webinar because we'd have to spend a whole hour to talk about this at least.
Well, that's good.
But please see in the chat, I've posted some stuff.
Great. Nina, do you want to come in?
Yes, not on this question, but I've seen another question, if I may, by Andrew. He's asking about changes in human, animal, especially wildlife interfaces are major drivers of zoonotic pathogen emergence, yet this doesn't appear to have been addressed in the treaty. It is, however, the language is not as strong as we would like it to. So there's language about addressing risks. The member states will endeavor to consider factors that drive disease outbreaks. There is language about prevention of emergence and disease emergence at the human-animal environment interface. However, this language is either still yellow or blue. So we need member states to approve and green this language so that it can then be operationalized, because we agree with you completely. This is a priority.
Yeah. So Paco, Alex, do you want to come in at all on these?
Okay, I would like to highlight that in what the kids say about the data challenge, and this is important that when we said that challenge data between the sector, but in the real practice, I think maybe sometimes it's very challenges because in the e-sector they have their own regulation, they have their culture to share information. So that's why I love the word that in the collaborative surveillance. Collaborative surveillance is kind of like a very good word. That means in the e-sector, before they implement any surveillance program, right? This good to join and ask and see that how they can collaborate. That's meaning that they understand the same page, but they may collect in their different format, right? That means they don't need to integrate all the data all together, but they understand how to plan to collect the sample, how to plan to in the terms of in the surveillance, in the which population, target population, and then they know even the any important they can be tricked on their surveillance system, how they can share. This kind of the good idea that is to start a cooperation among the sector in the real practice. Okay, that is what I would like to highlight.
Now we're coming very near to the end, but I know there was one question in that was about finance, and I wanted to come back to you, Chris, just on that. Which is, I mean, you gave a nice explanation that if you do things together and you do it in an organised way, it's not nearly as expensive as doing lots of mess around you. But there's still a big issue about finance for low-income countries. Do you just want to comment on that just as we close?
Yeah, just a quick comment. Of course, we're all aware that we're in a really terrible difficult time at the moment with the USG funding basically dropped off the globe, restrictions, Europe having to shift some of their funding priorities towards defense and so on and so forth. We all know where we are. So we're in a difficult situation. And when I point out that many of the leaders in developing and implementing some of these One Health initiatives that are sort of fundamental for this agreement, they have in the past also been dependent on funding from the global north. And so we do absolutely need to prioritize those funding streams, make sure that they are replaced and increased. And that's a responsibility for the global north. We can't only outsource our production and our exploitive practices. We also have a responsibility to the impacts that these have, obviously. So this is something that's always controversial, and we have this in the climate agreements, we have this in all of the agreements, but it's also definitely a point here. And I understand the concerns of lower income or resource restricted countries that want clarity on this. And I think that's still going to be a difficult point to move on forwards. But it's a global problem we have everywhere now.
Good, thank you very much. And I want to bring this to a close now. And I hope everyone's been really persuaded on the pandemic agreement that we really need to go and get it going. It won't be perfect, but it will give us the actual structure really to work on. And because it can be changed over time, both in the content or in annexes and protocols, it can move things forward. And we don't want to lose this opportunity to have, once again, nothing behind us really to work with. So I hope any of you who've got influence anywhere will be pushing for that just in these last few weeks to make sure it really happens. I do want to thank all the panelists. I think you've been really excellent in talking to people, including myself, who's not an expert in this area, just explaining what it's all about, both the treaty, but also actually the work on the ground. And really, and how positive it can be that it's given me much thought about how it could really all move on practically on the ground, which is what we want to see in the end. So thank you for the effort you put into come and presenting, and thank you to all the audience for being there and for putting in some good questions. So with that, I will over to, I don't know whether Marissa, you have to say, are you going to say something just to close? No? In that case, I will say thank you very much. Yeah, thank you to everybody. And shall we do a big wave across to say goodbye? Goodbye to everybody.
Thank you.
Thanks a lot. Bye-bye.
Bye-bye.
Thank you. Bye.